peritoneal sinuses from leading institutions of India by his minimal invasive hybrid laser surgery with Ayurvedic approach, Shara Karma and Shara Sutra treatment. He has nurtured many postgraduate scholars under his guidance at Patanjali Yogpeeth, Haridwar. Thank you, sir. I would like to welcome you for your stage is yours.
Respected Swamiji Maharaj and Param Pujya Acharya Shri, respected dignitaries and my dear students and my colleagues. Today's my topic is on an innovative hybrid techniques to treat benign proctological diseases with Ayurveda and laser surgery. So Maharishi Sushruta is the father of surgery. So they are the mentors of my career. I started my career since 13 years back from this institution, and under the guidance of Param Pujya Swamiji and Acharya Shri, we operated many cases from the renowned institutions of India, and they are all recurrent cases in proctology. So the center of excellence. So both all the four institutions, that is Patanjali Yogpeeth, PRI, Patanjali Ayurveda College, along with the University of Patanjali, is on the peak of their performing all the procedures and all protocols. So benign anorectal diseases, all of us and all of my students and my colleagues knows they are very common in the society. They are hemorrhoids or piles, they are fistula in ano, fissure in ano, and pyloneal sinuses. Shara therapy is an Indian contribution to the world science. Shara karma or caustic therapy. So it is a minimal invasive Ayurvedic parasurgical procedure, and the Shara is obtained from the ashes of medicinal plants, that is Apamarga, Palashan and Kagistra. So mode of action of Pratisarya Shara. So it cauterizes the bile mass, causing necrosis and fibrosis and scar formation. The complete wound healing occurs within 21 days of the procedure. You can see this is a before. This image shows before, during, and after application. So before application, this is the second degree hemorrhoid, and during application, you can see here you can see the Shara application, and you can see this is the necrosis of the immediate necrosis of the bile mass within 30 seconds of its application. So Shara Sutra, everyone knows about. This is very familiar therapy in India as well as abroad also. So it is formed by the 21 coatings of Snuhi Shira, Appamag Shara and Haritra Chota. So mechanism of action of Shara Sutra in fistula nano. It analogs to that of wire cutting to a block of ice. So what is laser basically? So how I integrate this laser with Ayurveda, that is Shara Sutra and Shara Karma. So laser is nothing but the light amplification by stimulated emission of radiations. The commonly laser which we use in our practice is 1470 nanometer wavelength. So types of laser fibers. So it is very important while operating a case of proctology. So we should know all three fibers, that is conical fiber which is commonly used for hemorrhoids, fibers for fistula and pyloneal sinus is a radial fiber, and for fissure in ano cutting of tissues it is the PR fiber. So principle of laser energy is photoablation, photocoagulation and photovaporization. So my first topic is hemorrhoids. Hemorrhoids are nothing but the inflamed or swollen anal cushion normally present at 3, 7 and 11 o'clock position as we read in many books, but it is not correct in my opinion. Hemorrhoids can occur in anywhere in the anal canal, In 1975, Thomson comes with the theory of another accessory pied mass, which is commonly located at 6 o'clock position. That is called as accessory pied mass. So conventional procedures in hemorrhoids. During my post-graduation, I taught across with a simple two techniques, that is open hemorrhoidectomy, that is middle and small ones technique, and other technique is called as Ferguson technique of hemorrhoidectomy. So though I operate here with the passage of time in 2010 to 2015, I operated these type of cases with these techniques, and personally I got the disadvantages. Definitely healing of the patient is very much, but there are some disadvantages of this procedure. That is, it is painful, more bleeding is seen, more tissue trauma, anal stenosis and anal incontinence. So in 2015 to 2020, I come across with another technique, that is, they are called as Shara Karma with bipolar sealer hemorrhoidectomy. In 2015, vessel sealers comes in the market, and I use these sealers for a combined therapy, that is Shara Karma and vessel sealers. Vessel sealer does not, it only coagulates the tissue and cut the tissue without any bleeding. So this is the vessel sealer hemorrhoidectomy. Due to the shortage of time, I will show you the minimal video clips. So minimal invasive hybrid procedure in hemorrhoids. From 2020 to 2023, we invented many procedures in hemorrhoids with a hybrid approach at Patanjali Ayurveda Hospital by the surgery department. They are FGR, that is finger guided hemorrhoidal artery ligation. Everybody knows about DGR, that is Doppler guided hemorrhoidal artery ligation. Doppler guided hemorrhoidal device cost about 10 lakhs rupees for the single or then I come in with another technique that is called as finger guided hemorrhoidal artery ligation. It is nothing but a ligation of superior hemorrhoidal artery, or the branches of superior hemorrhoidal artery, commonly occurs at 1, 3, 7 and 11 o'clock position. So first procedure is called as finger guided hemorrhoidal artery ligation with laser hemorrhoidoplasty. So this is FGR and this is the Shara Karma. FG, HP and Shara Karma. I come across this with many cases where I did this finger guided hemorrhoidal artery ligation with laser hemorrhoidoplasty. I have seen in the post-op cases there is a bulging of bile masses again with laser techniques. So I invent another technique that is called FGR with laser hemorrhoidoplasty and Shara Karma, which is a combination of an innovative procedure which is invented at Patanjali Ayurveda Hospital. So the last technique is called as transanal hemorrhoidopexy with Shara Karma. So Hall technique, it is nothing but a simple technique. This is the Hall suture, which is having 27 mm needle with 5x8 circle and round body, and the length of the thread is 120 centimeter. It is a special thread which is used for the ligation of the branches of superior hemorrhoidal artery. And the needle holder, commonly I prefer is the 9 inches needle holder. So before operating any case of hemorrhoid, the surgeon must know about the common appearance, that is the mucocutaneous junction, this is the dentate line, and this is the anal columns. So very important with laser. Laser is dangerous when we do not have the knowledge of the mode, fiber, dosage and energy. So for hemorrhoids, the commonly used laser is conical laser. The mode is a pulse mode, and in every pile mass we have to give 150 to 200 joules of energy per pile mass. So transanal hemorrhoidopexy with Shara Karma. This technique is invented, this transanal hemorrhoidopexy is invented by very much famous colorectal surgeon of India, Dr. Chute's technique of hemorrhoidectomy. So he blocks all the collaterals circumferentially. You can see the two-layer suture of exit. So these two layers blocks all the arterial supply towards the bile masses, and for then again in the end I will come with a conclusion. But the main complication with this procedure is the hemorrhoidal cushion remains the same. So I prefer to do hemorrhoidopexy with Shara Karma and having the excellent results. So I'll play another clip. Here is the, I'm filling the pulsation. So if I'll show the small clips of the procedure. So this is the FGR, that is finger guided hemorrhoidal artery ligation. I ligate the branch of superior hemorrhoidal artery. So next step is of bile mass before. So very important. These are the very delicate procedures. We have the handling is very important. Or regress the bile mass. This is the ligation of superior hemorrhoidal artery, that is a branch of superior hemorrhoidal artery at 7 o'clock. This is nothing but the insertion of laser fiber in the submucosal plane of the hemorrhoid. Then this is the application of Shara immediately. What happens in my clinical cases when I simply do the laser hemorrhoidoplasty? So there are, in many cases I come across with recurrences especially. So what I did is I apply my Shara over there, and there is fibrosis and there is a normal scar formation of the anal cushions. So next topic is fistula. This is very much interesting topic. More surgeons' reputation have been impersed because of the consequences of fistulas operation than from any other operative procedures. Fistula in anal is nothing but a tract which is lined by the epithelial tissue which connects in the anal canal or rectum. Conventional procedures in fistula anal. When I passed my post-graduation in my college, only 3 procedures are taught to us. That is fistulectomy, that is the complete excision of the tract. Fistulotomy, that is the lay open of the tract. And one more technique that is called as the coring technique. From 2010 to 2017. I usually perform partial fistulectomy followed by Shara Karma, Shara ligation in treating complex recurrent fistulas, and show some of the cases, that is the complex recurrent cases. So first case I will show you, this is the right-sided ischiorectal transventric fistula. So what in this procedure I have done, I excise all the tract up to the external anal sphincter muscles, followed by the Shara application. You can see the application of Shara in the cavity and followed by Shara ligation. Again, this is the recurrent healed left-sided ischiorectal intersphincteric fistula anal. You can see it is a recurrent case operated 5 times previously. Then I finally operate this case and you can see the complete healing of the tract here completely. So again, this is right side ischioanal transventric fistulas, the same technique. So this is an interesting case. So this is the scrotorectal fistula anal with complete healing of the tract. You can see the dissection of the tract is done from the scrotoanal region by avoiding injury towards the urethra, and these are the healing photographs of the post-op healing photographs of the fistula with iron dressings. So then follow complex fistulas after fistulectomy and Shara ligation. You can see the various types of fistulas, that is intersphincteric fistulas, transventric fistulas, supralevator fistulas. especially, and you can see this case also. Multiple incision has been given before. This case, I think 6 times operated. Then I operate this case with the help of my technique, that is partial fistulectomy, followed by Shara Karman Shara ligation. There are again follow-up of complex fistulas after window technique and Shara treatment. You can see the multiple fistulas here. In 2017 and 2020, again I come with the invention of another technique that is called as window coaling followed by Shara ligation, scrotoanal fistulas especially. So you can see this, the section of the tract from scrotum to various region, and then I made one concept, that is a window technique. That is, window technique is nothing but the lift technique. So with this technique, we made a intersphincteric window in the intersphincteric space, and the duration of the Shara becomes very limited. With my patients since in last 10 years, the main concept of the procedure is the pain. How much pain you give to the patient after surgery, that is very important. So you can see in this technique, there is small wounds and the scar mark of the procedure. It is very minimal with the last procedures. So when laser comes in the market, I attended many conferences with colorectal surgeon and come to conclusion with another technique, that is a hybrid technique in fistulas. So hybrid procedure is nothing but the synergetic combination of 2 or more procedures for increasing their efficacy to generate a better outcome. So the technique which is invented in Patanjali Ayurveda hospital by the surgery department is an innovative hybrid technique to treat complex fistula in ano. That is window fixation, laser ablation followed by Shara ligation. So you can see this picture. This is the intersphincteric space, and I create a window here. You can see this is the tract. So this device is the fixation device, and this is the laser ablation of the tract, and finally the Shara. So it is a combination of all the 3 procedures, that is window, laser ablation and Shara ligation. So what is fixation? So these are the circular plates you can see with a diameter of 3 mm, 4 mm, 5 mm, and guide, probe and base plate. Again, the protocol of the procedure in case of fistulas with laser is very important. You should know the fiber. So it is the corona 360 degree. The mode is the continuous mode. For example, if the tract is 5 cm long, we have to give 500 joules of energy. So procedure, I'll show a complex fistula with an hybrid approach. Another opening here, 11 o'clock. You can see, so this is a complex anterior horseshoe shape in fistula in female. So it is a form of horseshoe shape fistula. And so you can see the dye is coming. So it is confirmed by the dye test. You can clearly see the dye is coming from both the openings. So it attains the shape of horseshoe shape dye. So this is nothing but a window, that is the dissection in the intersphincteric space. So very careful while doing the dissection. Here are the external sphincter muscles. So I divide this intersphincteric space and I'll show you the tract. This is the tract inside. The whole tract is like this, and this is the intersphincteric space tract. So what I did is I just divide this tract. Internal and external sphincter. So I'll put the main, that is Shara from here to here, very small, that is around 1 to 1.5 centimeter thread inside, and rest of the tract from here to here I'll deal with fixation. You can see the mug inside the tract. This is the entry towards the anatomy view. So here is the hybrid procedure. You can see this is the type of short suture inside the main internal opening, that is the main gate of the disease. Use your fixation device like this inside the trap. So this is the insertion of fixation device in the remnant fistulous tract. So these are the coring blades, especially what I am using for coring of tract. So it should be rotated in a clockwise direction always. So you can see inside there is a tract. You can see this is the tract which is cored with the help of this coring device. So this is a specimen of cored tract. So it is cored from both the sides, from right and left, by avoiding injury to the external anal sphincter muscles. You can see after fixation from both the sides, you can see this is coming out. So this is a minimal invasive intervention in cases of fistula and anorectal. Then the laser fiber is put from external opening to the intersphincteric space. And laser energy is given. Here is the technology and Shara Sutra. You can see I will go by both the way. So what this laser will do? This laser evaporates all the watery content from the epithelial tissue. So you can see here. Normally, if I'll do this procedure normally with Shara Sutra technique, it will take more than 6 months to heal, and there is a lot of pain to the patient. I'll show you the follow-up also. So follow-up for 1 month. You can see how nicely granulated tissue in the post-operative with a very minimal Shara Sutra inside the tract. So the theory behind the fistula is only the main internal opening. We have to deal with the main crypt. Rest of the tract we can deal with any technique. So you can see finally after 1 month there is very little scar marks as compared to my previous surgeries. So hybrid procedure, the outcome. So in modern science there are various procedures. One is called lift, weft, fillet and DRPL. All the procedures are done in this institution with many recurrences. I have seen many recurrences in these techniques. The preferred technique is the window fixation, laser ablation followed by Shara Sutra therapy. So I got 100% results in this procedure. So what is fissure? Commonly all the people know a very painful condition. So it is the crack or tear in the vertical axis of squamous lining of anal canal. You can see here is the fissure. So the common surgical procedure. So previously what we do is that is called Lord's anal dilatation. It is nothing but the forefinger dilatation of the anal canal. Nowadays this procedure is totally banned by the American Society of Colorectal Proctology. The recommended procedure is the anal dilatation with the help of dilators. So you can see these dilators are used nowadays. With these dilators there is no bleeding, no tearing of anal canal, and there is no distortion of the anatomy of the sphincter muscles. The procedure right now I prefer with closed laser internal, that is lateral internal sphincterotomy, that is from medial to lateral. So I'll show you some, I'll give you the idea how to do. So this is the intersphincteric groove. So we have to just identify first the intersphincteric groove. So this is a tumescence with adrenaline and saline up to the dentate line. This is the negotiation of laser fiber inside the dentate line. You have to just cut the fibers from medial to lateral. It is very simple procedure. It relieves the spasm immediately. You can do also in local anesthesia. So pilonidal sinus, it is the epithelial triad commonly occurs in the intergluteal fold. So in this there is accumulation of air inside the cavity. So conventional procedures in pilonidal sinus. I have done this procedure up to 2010 to 2020. This is nothing but the complete excision of the tract up to the sacrococcygeal fascia, followed by Shara karma, and this is a specimen of pilonidal sinus. So minimal invasive hybrid technique in pilonidal sinus invented at Patanjali Ayurveda Hospital is laser pilonidoplasty, followed by Shara karma and Shasutra ligation. This case is the one of the difficult case I have faced in my 13 years of practice. I'll show you the case. New case, that is pilonidal sinus. You can see here. You can see the history of the patient. This patient was operated 5 months back in Haridwar, in some surgical hospital. What they did for this pilonidal sinus, they just excise all the tract. This is a recurrent case which is operated at SRUS Hospital in Faridabad by. She is a 20-year female patient, underwent 3 times surgeries of pilonidal sinus. So I prefer here is both the techniques, that is laser and Ayurveda. I'll show you the next slide. So follow up, I have done this laser pilonidoplasty with Shara karma and Shasutra ligation. This patient is healed within 6 weeks. So the question is, why laser and Shasutra? Shasutra is only for drainage purpose, not prosthetic. You can see after laser pilonidoplasty, I just put these Shasutras for drainage. Once the wound is granulated, I take off all the Shasutra out, and this is the final picture of the wound after complete healing. So post-operative management protocol, that is same for almost all the proctological are same. So advantages of minimal invasive hybrid procedures in proctology, always less is best, because there is a minimal pain, bloodless, short hospital stay, do not require long-standing dressings, and no chances of incontinence even in complex fistulas. Definitely yoga and pranayama is also helps in anorectal diseases. It relieves the constipation and maintain the circulation around the anal area. So there are 4 or 5 slides I want to speak, that is generating the generations. So this is a symbol of hand-to-hand surgical proctology training at our institution. The story of success. To become an expert in any profession, you need 10,000 hours of practice over 10 years. But with a good mentor, the time reduces to 5 years. Surgeons are not born, they are made at Patanjali Yogpeeth with the help of hand-to-hand surgical training. Perfection is not attainable, but if we chase the perfection, we can catch the excellence. So work in progress, time to refine and reconstruct. The most dangerous phrase is, we have always done it this way. This is said by Grace Hooper. Thank you.
surgeons, I think, pathological cases. I appreciate your presentation, especially in chara applications and as well as sweet chara applications, except for preparation of the chara and the hemorrhoids. You are dealing with such a beautiful techniques you have shown, especially the FGHAL, that is your finger guided hemorrhoidal artery ligation. You have shown really the real way of how to do it with the laser therapy, with the new invented technology, as goes with our present scenario of this conference, that is technologies have been used, how it has been used. So you are one step ahead of future time using the laser therapy in hemorrhoids. Yeah, and then we appreciate the videos of transferal pexy and laser techniques, proctological procedures, fistula procedures, and fissure in ano, bilateral sinus, treating bilateral sinus. And the last, you are summing up with the generating the generations for surgeons. Then surgeon is not a born one, but made surgeon. And also the simple formula of the time factor, what you told, that any mastery you get for 10 years can be guided with the best master. You can come down to 5 years. A wonderful formula. We appreciate. And any questions, please, for him, please. We lack time. Let's go for lunch. Yes.
So I had this one question which intrigued me throughout this presentation.